Good afternoon, everyone. Welcome to the City of Alameda Mayor's Town Hall. I'm Sarah Henry, the city's Public Information Officer. Joining us today for the first half hour to talk about playgrounds reopening is Alameda Rec and Parks Director Amy Wooldridge. And joining us shortly is Alameda resident, elementary school parent, and pediatrician Lisa Siskin to talk about being safe and healthy at our playgrounds. Then for the second half hour, we'll talk about the County Health Department's updated shelter-in-place order that now allows elementary schools to reopen with AUSD Superintendent Pasquale Scuderi. Please note, all participants have been muted. To submit a question for the mayor or for our speakers, please use the chat feature. All of our town halls are recorded and are available on the city's website and our YouTube channel. I'd now like to turn today's town hall over to Mayor Marilyn Ezzy Ashcraft.
Thank you, Sarah, and good afternoon, everyone, and welcome. Thank you so much for joining us today. It is too hot to be outside anyway, but I'm thrilled that at least we have clean air quality, which is really something to celebrate. Oh, I will just mention, because the temperatures are forecast to be in the upper 90s today, and also yesterday, we have our library, the main library on Oak Street between Santa Clara and Lincoln, open this afternoon, Sarah, between 1 and 5 p.m.
Correct.
For cooling and clean air and all that, although the air is clean outside. But for those who are sensitive to heat and don't have a good place to get cool, you can go to the library. All the COVID restrictions are in place. You'll be socially distanced. And it's not the library per se with the books that's open, but the cafe space and the conference rooms. So just so you know, that's something the city does. Well, I want to, I was joking with Sarah Henry and our Recreation Parks Director, Amy Wooldridge, before we went live, that I'm calling today's episode the Children's Hour, because we're going to hear from Amy some really exciting news she's going to share, and then our pediatrician mom is hopefully going to join us and talk about how that all relates to Amy's news. And then we're going to hear from our superintendent of schools, Pasquale Scuderi, a little later in the hour about some exciting school news. But all of this is thanks to all of you. I really do think Alameda residents have gone above and beyond in making our community safe from COVID-19, holding the rates down, and that has allowed us, and again, I think you all know by now that we don't move as individual cities in Alameda County. There's 14 cities in Alameda County, and then there are unincorporated areas, and we move as one. And so we've got to get those case rates down before the state and our county public health officers allow us to move into the next tier. But that's what you've done. You have contributed to that. And so we're really excited to be able to open up some new activities. What we are doing, and you've probably read about this, although we qualify for the orange tier, which we've gone from purple down to red, down to orange, we're doing well. Our public health officer, interim public health officer, Dr. Nicholas Moss, wisely is being very conservative, and he's keeping the businesses back. I mean, we're not closing anything back down. Outdoor dining is open, and there's some more activities that can be done, but he's not moving as fast as he could in the orange tier because schools are going to start to reopen. And we always know that whenever you open a new activity, you have to expect some increase in COVID cases. So you just don't want to open too many things at once. And he is wisely prioritizing the children. And I think we've got a lot of parents on this call. A really cute photo, Jocelyn Douglas, I'll just say I'm looking at, of a little one. But you understand the hardships that these closures of schools and kids not being able to be in, play groups and the kinds of activities they normally would do. You understand that impact. So we're going to have some good news that you all are ready for and deserving of. So it is my pleasure to introduce Amy Wooldridge, our phenomenal, hardworking Recreation and Parks Director. Amy, the floor is yours.
Thank you, Mayor. I'm happy to be here. I'm happy to share the news that the county health order is being updated so we can open playgrounds again. This has been something that many parents are very excited about, and families and guardians. And so And I want to put out that I'm extremely grateful for our park maintenance crew and give them many kudos, because when we first heard about this that was coming a couple weeks ago, we thought we'll be lucky if we get a few playgrounds open, and they pulled it off, and every single Alameda playground will be open as of tomorrow morning.
Yay!
Yeah, we've cleaned them all. We've done safety checks on them all, so they'll be safe for our kids and families. It is important to note that we're not monitoring the playgrounds. It is the responsibility of families and caregivers and any adults with the children, to make sure that the adults and kids are following the safety protocols. Everyone 2 years and older should be wearing a mask. Everyone should maintain 6 feet from any individuals that are not in your household. I know that can be challenging with a bunch of kids that have been withheld from playgrounds for 8 months, but do your best. Also, it's important, no food or drink on the playground, because that's an easy way to transmit. And wash your hands and sanitize. Every one of our parks has a restroom. All of our restrooms are open, but it helps to bring your own sanitizer as well. At the parks where the restroom's not directly adjacent to the playground, we're adding additional hand sanitizing stations. And in fact, in some of our key parks, we've already added permanent hand sanitizing stations. They kind of look like drinking fountains, but they're hand sanitizers. And plan ahead, because it's important. It'll really help our whole community if you don't always go at the peak time of the day, right? On a late morning to early afternoon on a weekend, but try and pick different times of day. We're lucky here that we have such beautiful weather. So if people can kind of spread out when they go, and also try the signage you'll see out there, ask people to limit their visit to about 30 minutes if you see a lot of other people there, just so other people can come enjoy the playgrounds as well. Also know when to stay home. If you or anyone else in your household is sick, please stay home. And that's about it. The other thing I did want to mention too, is the other exciting news, is that we're also opening the Alameda Point Gym at 10% capacity later this month on October 26th. So we've let all our youth athletic organizations inform them of that yesterday, and they can start reserving, and we'll have a lot of safety protocols in place. So it's not drop-in, it's for the teams. They're not allowed to play games. They will have their social bubbles of 15 or less, just as we're doing for outdoor youth athletics, but we're excited to be able to bring basketball and volleyball back. So that's it.
Thank you, Amy. That sounds like a lot of planning went into this. That I'm glad to hear that you're actually putting in permanent hand sanitizer, hand washing stations in parks where the bathrooms are not readily accessible adjacent to the parks. And you know, the admonition to not bring food or drink. I mean, water is fine, right? We want everybody
Absolutely.
to hydrate, especially in this warm weather. But we have had concerns raised by parents of children who have food allergies that, you know, they can have some little one with, you know, peanut butter on their hands swinging on the swings, and the next child goes to swing on those swings. And you know, could spark a reaction. So it's just sounds like a good idea altogether.
You're absolutely right, Mayor. And it was actually an educational effort we were starting just prior to COVID, this past January, February, to start signing out at the parks. Even something like milk, I learned a lot from some parents that came and were advocating that their kids have had allergic reactions from Alameda playgrounds. One kid might have some milk and it's on their hands, and you don't, as a parent without kids with allergies, you don't really think about it. And some other kid can come along who does have high sensitivity, and it can wind them up in the emergency room. So that's really important in general, not to bring food or drink on the playground. You certainly have it and have a picnic. Not at the picnic tables, those aren't open
Right,
yet, but
right.
out on the open lawn, feel free to have a picnic, wash hands, and then have fun at the playground.
That's
Absolutely.
right. There's a lot of things you can do at our playgrounds, the picnic tables, as Amy mentioned, both in our parks and also Crab Cove, which is part of the East Bay Regional Parks District. Those are all those shared surfaces, so they're off limits for now, but there's nothing that keeps you from bringing that blanket or, you know, ground cover to put down and just have your own picnic out on the grass under the trees. I think That's great.
Absolutely. And I just a couple more things I wanted to add, and I'd love to take questions too, is the other thing that's open I forgot to mention is the adult playgrounds, the fitness equipment that we have at Lincoln Park and at Washington Park is also being opened next week along with and is allowed by the county health order. And the last thing is about supervision, since it is the responsibility of families and caregivers to supervise their kids. I really strongly encourage all times, but especially now, to not be on your cell phone, to try and just put it away when you're there with your kids, when you're at the park, put it in your pocket, enjoy the time with your kids, and make sure you're keeping an eye on them, because when you get sucked into your phone, it's easy to not pay attention to what's going on around you. So at all times, I encourage that, but
Yeah.
especially now.
Such a good reminder. You know, Amy, I've had a couple of inquiries from residents asking about basketball courts. Tell us about basketball courts. You be the one to break the bad news.
So basketball courts are, I have talked directly to county health about that this week. I'm now meeting with them every 2 weeks as we're starting to open things up. Um, they are not currently allowed unless we can manage to maintain 6 foot distance between households. And when you're playing a game, that's pretty difficult to do. And as a public facility, we can't manage and say only shoot hoops, don't play games, for example. However, that said, there is kind of some flexibility within that we're working with. I'm working with the city manager, working with county health to see when we can open those, because we recognize that we want to make sure it's equitable for everyone in terms of people play different kinds of sports, and we want to make sure that there's something there for everyone. So we are looking at that and trying to determine what we can do to get those courts open
Thank you.
safely.
And then the other thing is group games. Tell us limitations, what people should know about group games.
Sure. So group games are not allowed. They are happening out there. We have a park ambassador program on weekends where we have staff going out and just doing friendly education out in the parks. But playing a big pickup game of soccer out on the field with people that are not in your household is not currently allowed and not recommended. Certainly, if it's folks in your social bubble, then that is allowed. So that's where it's tricky for us, and what in terms of we get questions sometimes, why aren't you telling people no, why aren't you enforcing this? But it's really challenging because we don't know, and it's really not our place to ask, well, are you a social bubble, are you not, a and it gets complicated, right? So so that's why we've really taken an educational approach to just let people know, hey, here's the current rules, and it's to keep you and the whole community safe. So group games, unless it's your social bubble or household, are currently not allowed.
I like to say that we are operating a bit on the honor system because we simply do not have the enforcement capacity, even if we wanted to go around. I mean, I will say that we have code enforcement officers in East Bay Regional Parks District Police are out patrolling on busy days at the beach and Crab Cove, but it is not nearly as efficient and effective as people just policing themselves. You know what it is you need to do. I like to say, we are not science deniers here. We believe what Dr. Anthony Fauci tells us. Your mask is your best protection for yourself and others. 6 feet of social distance from people not in your same household, washing your hands frequently, and then we can do a whole lot of things while we reduce the spread of this disease. But I am now going to introduce a guest who I believe just joined us, and that would be pediatrician Dr. Lisa Siskind. Is that you, Lisa? Dr. Lisa? Give a wave if
Oh,
that's
yes,
you.
I'm here.
Yes, you're here. Thank you. So thank you so much for making time in a busy day. Dr. Lisa is a pediatrician, but she's also a parent of children in the AUSD. And so we've just been talking about, our Recreation Parks Director, Amy Wooldridge, gave us the good news that tomorrow morning, all 20 of Alameda's parks across the island will be open. The playgrounds will be open. And so, but as Amy was saying, she didn't quite say it in so few words, but we're not going to be running around behind you with our spray bottle of sanitizer, wiping everything down. So what would you as a pediatrician and mom, what's your best advice for people taking their kids to the park for the first time, to the playgrounds for the first time in 7 months?
Yeah, well, I mean, I think it's very exciting that they're open, that kids, haven't been able to be playing on them for a long time. But I think the same, it's interesting. It's the same mitigation factors that we use in general. Social distancing is important, especially from people not in the household, and really important that it's really tempting for kids to congregate. And so I think one thing that I think, even just my own experience, my own kids when I was little, is like, oh, great, the kids that go to the playground, I can kind of keep half an eye on them and have a conversation with, the other mom. But I think parents have to be really, really vigilant about what their kids are doing. And it's really going to be a full-time eyes on the children to make sure that they're not congregating and interacting with other kids in the household, or that aren't in their household. And, obviously, the less people on a play structure, the better. So, either go early, go late, go when there's not a lot of people there. I think the state says if there are a lot of people there, there's a limit of 30 minutes that your family's supposed to stay. But then the other challenging thing is that the state has required that that kids 2 and up on the playgrounds wear a mask, which I think a lot of kids 2, 3 are not used to wearing masks. A lot of them are not required to wear masks even in their childcare situations. And so, for parents to practice with the kids that they're going to be needing to wear a mask, that practice at home before you go. Because we do know that masking is such an important mitigating factor, preventing respiratory droplets from being transmitted as kids kind of run into each other and all touch the same surfaces. So that's important. And then also note, which is another thing with toddlers, is if you're eating or drinking, which is why I think they did this, your mask has to come off. And so I know most families are very used to giving their toddlers and their young kids snacks, but it really cannot be done on the playground. You got to pull them off, go somewhere, far away from everyone else, if they do need a snack, and wash hands. But I think, if parents are vigilant and are partners with their children, and, making sure that, lots of households aren't on the structure at the same time, I think our kids can still enjoy it, just like, everything else, a little bit differently, but kids get used to things really fast. So, and I, like, in my office, we have kids 2 and up when they come in wear a mask, and most of them are fine for the 30-minute duration that they're in the office. So I'm assuming they'll be okay with it on the playground. So some better than others, but they can learn.
Yeah, well, it might be that, the incentive of if you put this on, you can go play on the play structure for 30 minutes.
Yes.
And, you and I don't think you and Amy worked this out ahead of time, but she made the same point you made about parents. Please don't be on your cell phones doing other things, multitasking while the kids are playing. You really do need to keep an eye on them. But that is great advice. And aren't you excited that kids can go back to playgrounds?
Yes, so important. And the other thing I didn't mention is high touch surfaces. We know that surfaces are not the main source of transmission. It's more respiratory droplets. But again, if you do have someone who, touches something and then immediately touches their mouth that another kid is possible. So, just, wiping things, washing your hands. And then the most important thing actually that I should recommend is that please, even though it's outside, do not bring your child to a playground if they have any symptoms of anything. And that includes a runny nose, because in kids, we know COVID symptoms are much more mild, and a runny nose in a kid can be the only symptom of COVID. I know a lot of people think, well, my kid only has a runny nose, it's fine. But please, if your kid even has the slightest runny nose or congestion or something off, don't bring them to the playground where there is a lot of high touch surfaces.
Oh, really, really good piece of advice. Sarah, do we have playground related questions for either of our guests?
I just have one so far, so folks are welcome to add their questions to the chat. But Amy, this one's for you. This person has asked about youth sports organizations. They've said that Little League and Alameda Youth Basketball have to meet the county and state requirements, so why can't the city allow the use of courts and fields for these groups?
So we have been allowing for quite a few months now the use of fields. We've let all of the organizations know that. There are very specific restrictions from the county and the state on youth athletics. And so, for example, we have AGSA, the softball is out there on a regular basis. They can do conditioning, they can do drills, they just can't play a game with another team because then you're sharing equipment with those outside your group. And then the other parameters are things like each group, they need to be no more than 15. The coaches need to stay the same and only coach one group, and for a minimum of three weeks at a time. And that's just to reduce the number of people in contact with each other. And as of October 26th, we are opening up the gym at 10% capacity. So that'll be enough for one 15 member group to play in the gym as well. So it is possible for all those organizations. Not all of them have chosen to open up their programs.
And, you know, while I have both of you here, this is related to kids, but not directly playgrounds, but Halloween is coming up. And I'm joking that my costume this year is the Grinch who stole Halloween, because I am just thinking that, well, and the public health officer, Dr. Nicholas Moss, agrees that we shouldn't do Halloween as usual this year. But both Dr. Lisa, do you have views as a pediatrician and parent about Halloween risks it poses if kids were to, say, do trick-or-treating and holiday Halloween parties? And then Amy, you could maybe touch briefly on what ARPD is doing. Do we still have Dr. Lisa? While we're waiting for Dr.
Yes, I don't know
Yes,
what
there she
happened
is.
to my.
I know you disappeared, but if you did you hear my question though about Halloween?
Hi, can you
Hi.
hear me?
I can hear you. Yes.
Yes. Oh, okay. Sorry. Yes, I agree. For Halloween, I think, trick or treating. I agree with the county health officer. Trick or treating tends to promote congregation of lots of people from different households, and I think that's the big. My own joke, but I think small gatherings with the social bubble, you can still dress up in costume, you can still do fun things, but I think this year parents can be the people who give out the candy, just because trick or treating it just really promotes congregation of so many people and so many mixing of households that aren't in the same social bubble, that it's just not worth the risk.
Thank you. I appreciate that. And how about you, Amy? Want to go run down the alternatives that you and your
Sure.
staff have come up with?
Sure. So we're doing, Alameda Rec and Park Department is offering a series of unfortunate Halloween events this year for the week leading up to Halloween. It's a bunch of virtual events, and in addition, on our website, we have a whole list of ideas and references to resources online for things you can do at home, like you can do trick-or-treating in your house as a scavenger hunt. And so there's a lot of different, and it gives you ideas for scavenger hunt clues. There's things like that, and ideas of what to do at home. What we're doing, a lot of it is on social media. So we encourage people, you can post your pictures of your family, your kids, your pets, and in costume, we are doing a pumpkin carving. We want to see your fabulous pumpkin carving and post those. We're doing a not so scary ghost story hour where people can zoom in and hopefully in costume and hear some not so scary ghost stories. We are doing a Halloween trivia, family trivia, starting at 6 o'clock on Halloween itself.
With prizes.
With prizes.
If
We
that's
want everyone to come
motivational.
in costume. Yes, and so please register please register in advance. You can do that through our website. That's no cost, completely free, but you do need to register to get into the Zoom. And yes, there are prizes, and the theme is Disney heroes and villains, and Halloween style. And we also just added, so breaking news for this group, we're working with Alameda Theater, and Friday night before Halloween, Alameda Theater will be showing showing a family-friendly Halloween movie, and before the showing, we'll be broadcasting all of these fabulous pictures of people and their kids and pets in costume. So if you go to the movie, you'll get to see yourself on the big screen.
Where will that take place, Amy?
That will take place at Bricks out at the base.
Thank you.
Yeah.
I can. My heart rate dropped a minute there when you said Alameda Theater.
Oh,
But
I'm sorry.
theater
Thank you.
is
It's a
not open yet.
drive-in.
Yes.
Yep. Let me clarify. It's a drive-in theater, drive-in only at Bricks. They're showing it on the wall of the big building.
Cool.
Thank
And
you for clarifying.
that's out at Alameda Point, and
Yep.
Bricks is BRIX if you need to do a Google Maps to get there. And then I guess more information will be available on your website, right?
Absolutely, as well as the
Great.
Alameda Theater website.
Yeah. And then I understand that there is one more question for you that Sarah is going to ask. And then it's almost 12:30 and we're going to segue, but we'd love to have you stand if you can. And Dr. Lisa too, we're going to segue to our superintendent of schools, Dr. Pasquale Scuderi, who also has some exciting information. And I also want to mention that I see AUSD school board member Jennifer Williams on the chat. So welcome, Jen. Thanks for being here. Sarah, what's your question for Amy?
So last question, this person says that as a lifetime fitness and health educator, what's the process and protocols if a PE teacher wants to use the park with their students, 15 max and other protocols, for example, during school instructional hours?
Yeah, great question. I'm glad to hear it. If you just call our office, we do have a permit system in place. So we just ask that people pull a permit with us. We've made it as affordable as possible. And what that does is help us ensure that our different fitness groups are appropriately spaced at different parks. So we do already have a number of businesses, for example. There's a karate studio that's been doing their classes outdoors at Lincoln Park for a number of months now. There's a ballet group. And then ARPD also has outdoor fitness classes through our programming. So we absolutely encourage it. Just call our office at 510-747-PLAY or arpd@alamedaca.gov. Or just Google Alameda Rec and Park and all the information's on there.
Great. Thank you. Thank you so much, Amy. And I also, I see another board member from our Alameda Health Systems Healthcare District Board, and that is Tracy Jensen. Hi, Tracy. We've been very grateful to the Alameda Hospital and Alameda Health Systems for their assistance in in our COVID response. And I know not this weekend, but October the 26th, Saturday, there is a flu shot clinic happening at Alameda Hospital, I believe out in the parking lot. Oops, let's see here. Can you hear me okay? Okay, great. I was a little excitement here. I'm seeing unstable internet connection message. I'll just hope for the best. Talk fast. Well, I want to now pivot a bit. This is still the children's hour, but we have Susan Davis, the public information officer from the school district, Sarah's counterpart at the school district, and they communicate with each other to just get important messages out. But I'm honored to introduce our superintendent of schools, Pasquale Scuderi. And Pasquale and I have been working together, gosh, since you came, but even more closely since the beginning of this pandemic and all the different changes that you've gone through, and you have a big change coming up now soon. And so I am so appreciative because I know how busy your schedule is, but he has carved out 30 minutes for us to tell us a little bit about what's in store for AUSD and then take some questions. So welcome, Pasquale. Lovely to see you.
Thanks. Thanks so much for having me. Hello, everybody. I thought I would, Sarah, I don't know, is it possible for me to share my screen?
It is. I've made you co-host, yeah.
Okay, let me just get to where we need to be. And, okay. Okay, it's the right one. It says October 16th, Mayor's Town Hall. So, good. Version control. So good. Yeah. Version control. Yeah, we're off to a great start. Thanks again for having us. I'll try to move quickly through a kind of a condensed version of what we presented to our board the other night to talk about what our next steps are as we kind of start our way down the cautious path towards reopening our schools. The significant change, as many people on the call probably know, is that on October 1st, we got word from County Public Health and the County Office of Education that we could begin the process of opening elementary schools after October the 13th. Some of what I want to cover today is just clarification on the fact that that October 13th date wasn't necessarily a date that said, no matter where you are in terms of preparation for reopening, you can reopen after October 13th. There really was a timeline for people to begin to start submitting reopening plans. There are private schools and very small charter schools that are going to be open probably sooner than a lot of our larger and mid-sized public school districts, because the logistics involved and the scope and scale of what those much smaller institutions are dealing with are just much more easy to complete. We do have a good chunk of our reopening plan completed, and our goal is to share that with the community next week. The reopening plan is something that we are required to submit to the County Office of Education and the Alameda County Public Health Department after we get their approval or have submitted it and checked all the boxes. And once we're up and running, then we can begin our process, and I'll describe what that local process will look like in just a moment. It's really important to be super clear on what we're talking about here. The current modification of the public health order applies only to elementary schools. We have no guidance at this time on dates or processes or restrictions and permissions around middle and high school. We know that on October 1st, when we received the guidance that we could start looking at reopening elementary, we were told that guidance on secondary schools, middle and high schools, would be coming 4 to 12 weeks retroactive to that October 1st date. So certainly as soon as we get more direction and guidance on middle and high schools, that will be folding into our reopening plans. You know that part of the reason that we are having this conversation now is that our county, fortunately, the two metrics that people are paying the most attention to, test positivity rates and the community transmission rates, have declined notably in our county over the last several weeks. We're currently sitting in that moderate area, but the county has not been reassigned to that area because we haven't met the 14-day threshold. So as we begin this conversation about reopening, which is making some people very anxious and making other people very hopeful, and a lot of people, it's making them both, I just want to kind of remind our community that we are continuing to ramp up and push up and do everything we can to kind of move north on our preparations and safety protocols while the county transmission rates continue to go down. The fact that the community transmission rates are going down is not for us a license to get complacent or to be less cautious about safety measures in our school. But I do think as we have this tough conversation about when it is appropriate and safe to return, people need to know that we are not dealing with the same public health metrics that we were in mid-July. Our next steps will be to complete this plan, and you are all going to be available to review it. Our goal, again, is to have something that can be mutually inspected by our board, our staff, our families, our community members, our community partners, so that you can really see in narrative form the level of detail that we've put into a number of the key criteria that are required in the reopening plan. We're going to make that available, let people digest it. And then on the 27th, we're going to go back to our board on October 27th. And it is at that October 27th meeting that I will likely propose a date that we can begin to return to in-person instruction. There's going to be a lot of big ifs that accompany that date, to be sure. And I'm not being cagey or elusive. There's just a few things that really need to fall into place in the next 7 days or so that are going to have a profound influence on whatever date we propose. Our reopening plan on that night, hopefully, if our board gets their look at it and gives us a thumbs up, will get submitted to the public health and county agencies that I've referred to already. And then if there are no major modifications or adjustments, we'll come back to our board on the 10th of November. And at that point, we will know whether or not the date that we've set on October 27th is one we're going to keep pursuing, or whether an adjustment it needs to be made at that point. All that is to say, while there is a lot I cannot tell you yet for a number of external reasons, I don't see this happening before Thanksgiving. I know that there are people who are anxious to get back right away, but really the number of things that still have to be adjusted in accordance with the way the guidance has adjusted over the summer. Just do not lead me to see a scenario where we could propose anything that would happen before the Thanksgiving break. I won't read each of these criteria off, but this just gives you some sense of when you see a 40 to 50 page reopening plan, which is not the most easily digestible or bulleted document for a community to kind of engage in collectively. It is, in fact, by necessity that this document that we're putting together is going to be of some notable length because there are a lot of criteria that we need to cover. Our current concept for reopening in this phased return would be to bring kids back in grade level groups. We have spent a lot of time between May and now talking about how we would do this in the theoretical realm, but when we get back on campuses, a lot of our systems, a lot of our protocols are going to be tested in real time, are going to need to be adjusted in real time. And we really believe that the smaller and more graduated and gradual and incremental approach that we have to this, the more likely we're going to be able to respond in ways that prioritize safety, that allow us to make adjustments, and ultimately over the long haul, get back to a place that is really returns the educational experience that we want to the entire community in full. Lots of questions about indoor air quality. We have spent a ton of time on this. Nobody, I think, is going to achieve that sort of clinical clean room, laboratory, hospital room, operating room standard. We are, in fact, a school, but we will be employing a multi-leveled strategy to managing the indoor air quality in our classrooms that has 3 layers in most places and a minimum of 2. We have upgraded all of our mechanical ventilation systems, our air conditioning and HVAC systems to MERV 13 filters, which is an entry-level hospital-grade filter. In many schools and many classrooms, we're going to be relying on outdoor air quality. Fresh airflow is a great asset and ally, if you will, in combating the transmission of COVID in classrooms. And then just this morning, we were out in another district looking at HEPA purification systems. And while there's a significant cost involved in that, for a lot of reasons, we're going to add that 3rd layer to all of our classrooms. So each and every one of our classrooms, as we come online, will have this 3rd level of air purification through these portable HEPA filters. There's been a lot of questions about staff testing. And I think the easiest way I can kind of describe this is that visually, all of our staff is going to be tested 1 time a month. Roughly 25% of our staff will test each week on a rotation. And we, the mayor and I and some of our staff had a conversation, I think, along with Board Member Williams recently about partnering with the city on test sites that they may be considering. The County Office of Education in Alameda announced yesterday a major contract with Curative Labs out of Los Angeles that is going to provide school districts like us the ability to contract testing services and have staff tested on site. So that's significant progress. And then many of our employees will choose to go to their primary care health provider because any essential worker is entitled to get an appointment from their primary care provider within 48 hours and within 30 minutes of their home. In addition, any free or pop-up community test sites we'll take a monthly test verification from those folks as well. The challenge for us internally is that now administratively, we've got to kind of put staff in place to monitor, follow up, and manage this significant increase in employee information that we're going to have monthly. And as we go along, continued constituent and stakeholder conversations. We're talking with grade level teachers, talked with all of our clerical office staff yesterday, meeting with principals. Once the reopening plan is released, plenty of opportunities. We'll be out in the community holding virtual forums where folks can weigh in on the plan, comment on the plan, and just kind of help us chew on the remaining variables together. And so that will continue to move forward. Again, preliminarily setting a date or a goal on October 27th, and then assessing our readiness toward that reopening goal on November 10th. Those are the 2 key dates we're looking at. Final 2 slides, just want to really make sure that folks in the community understand some of the big variables that neither we or our partners across the county and state have figured out sufficiently. One of the things I want to get across is that in an initial or partial reopening, it's not going to be business as usual. And as much as that may frustrate some folks out there, we're not going to go back to a pre-COVID schedule right away. We're talking about probably limited units of on-person, on-campus instruction, at least in the near term. We're going to have split cohorts still on campus for a few hours a day initially. And one thing that I really want to note that we anticipate is going to be a significant challenge, not only for staff, but for families, is that student absences are going to be more frequent and longer in duration, basically by public order. The health department is telling us that a single symptom of COVID in a student means that student has to go home for the day, which means parents are going to have to pick kids up in these initial stages, probably with a frequency that would be greater than if we were dealing with a single symptom in pre-COVID era, if you will. That's going to mean all kinds of logistical challenges for us to support those students. What happens if parents can't pick up students and they're symptomatic? These are really issues that we're still working on that will probably require additional staffing and the utilization of a lot of campus space early on. Another final thing to consider that is really keeping me up at night a lot is staff illnesses and substitute teaching. We, again, by public order, anticipate more staff absences that are longer in duration. Even if you test negative or don't get a COVID test right after a cold or flu symptoms, the county is telling us that your symptoms have to resolve themselves and you have to be 24 hours without a pain reliever. So a teacher absence of 1 day is going to be a teacher absence of 2 days. And the thing that drives us crazy in our thinking is, well, what do we do for substitutes? The idea of bringing another teacher into a classroom where you're trying to manage a stable cohort is kind of works against the principle or the standard we're pursuing. We do have a limited pool of substitute teachers already, and the age of our substitutes, the median age, tends to skew higher. So my concern is that some of the folks that we had coming in as substitutes prior to COVID may have a greater risk of doing so in the initial stages of a return. So does that mean more frequent class cancellations? Does that mean single building subs, having one substitute assigned to each elementary school so the cohort stability is preserved a little better? Just gives you some of the contours of a really kind of seemingly small but hugely impactful challenge that we're dealing with on the road to reopening. So I know that's a lot in a short period of time, and I tend to talk pretty fast, but that's where we're at. Anything and everything you want to talk about, I'm here to hopefully help.
Thank you so much, Pasquale. That was kind of a crash course right there. But I think you must feel like I do at times that despite the number of years we've held our positions and the training we had, nothing quite prepared us for dealing with all this. And we're kind of learning as we go. And I just applaud your efforts for thinking, well, and working. I know you're working with County Public Health and the County Department of Education on bringing these plans and to eventually bring our students back into place. So thank you for all that. And one of the things and I know we have questions that have come in from those of you out there in the audience. Sarah Henry's connection dropped, so she'll be back in a moment, but she's got the questions. So I am going to ad lib a little, although let's see if I go to full view. Let's see if I can see everybody. Oh, do you want to, Pasquale, maybe if you take down your slide presentation, I can see the whole audience. Let's see how that works. Okay. All right. So I am going to just take COVID school reopening questions now because we've got a lot of them and not too many minutes left. But okay, there is a question about will there be a discussion